Hello, everyone. We're back again. Asthma, COPD, pharmacotherapy. It's a tiny presentation. It's only 7 slides, but it's jam-packed with a ton of stuff. Guaranteed test questions are going to come from here. You're going to see this stuff. It's going to be beneficial for ICM. Well, I'll make a prediction. I haven't seen the ICM test, but I think it's going to be beneficial for ICM and definitely beneficial for pharmacology exam. And then also beneficial, too, just out when you're out in practice, etc. So, as I mentioned before, the asthma quick reference from NIH is great. It's a great resource. If you like the setup of this better, feel free to study this, use this. It doesn't matter. It has the same information that I'm going to be providing with you today. Where I'm getting my slides and my figures from is from Up to Date. So the format's a little bit different. So you notice here's a stepwise approach for children that are greater than 12 or adults. And then here it is from the NIH, same information here, greater than 12 years of age. And then here are the steps, step 1, 2, 3, up to step 6. So I provide both because in the past, some students, they really like this chart. They hate the other one. Some students like the up-to-date chart. Either way, my feelings aren't going to get hurt. I don't care what you all study, just as long as you study it, right? So just whatever. I mean, up-to-date I'll provide both to you. Up-to-date you have, but then I'll provide this quick reference NIH PDF to you guys so you can have that to study from. I think they're both good and they have a lot of good information, but look at either one you want. The other quick thing I want to note too with Up to Date, if you go here, I just search asthma step, and then down here, scroll down to the left, go graphics, view all. The reason I'm showing you this is it's not necessarily beneficial for pharmacology module or pharmacology exam, but I think it'll help you during this module for ICM. So it has asthma control figures. It has a childhood asthma control test. It talks about the peak expiratory flow, the PEF, has all that stuff there. MDI, the meter dose inhaler technique, how you can use that, how to use powder inhalers. It has an asthma action plan, may be beneficial, asthma trigger question, occupational asthma, etc. Initiating prescriptions for patients, inhaled steroid doses for adults, the glucosteroid doses, and then also the stepwise ones. This is what I got those here. I just want to show you that it's all under this overview of asthma management on Up to Date. They have what I consider really good graphs, figures, forums, etc. And this stuff may be beneficial for ICM. But we're not here for ICM, right? Are we? No, we're here for asthma. No, and we're here for pharmacology, pharmacotherapy. So this first table here, I have it on, you can see here on my PowerPoint presentation. You guys have the exact same one. I'm actually going to use this one over here just because it's bigger. It's easier for me to see and it's easier for me to read, but it's the exact same table that you guys have in your PowerPoint. But I want you guys to look at this. This is the stepwise approach for managing asthma. I'm focusing on this one for the children that they're 12 years old or older, and then adults. So for testing purposes, I believe it is going to be important for ICM to look at all the different ages, but I'm not sure. You'll have to check with them to see about that. But for me, I definitely want you guys to focus on the drugs and know what drugs are used where. So you'll notice up here, there's intermittent asthma and then persistent asthma that requires a daily medication. So it's pretty easy for students to learn that, or for my testing purposes. For intermittent asthma, what do you use? It's one drug, SABA, short-acting beta agonist, right? SABA, and it's PRN, as needed. So that typically means you prescribe albuterol as needed, is usually what it is. So intermittent asthma, everyone should get that test question correct for my exam. What do you prescribe? What do you give the patient? SABA, right? And usually, like I said, it's albuterol, whatever. Make sure you know short acting from long acting because it is important. On each step too, you do need to do patient education, environmental control, management of comorbidities, etc. So that's something that you need to look at. The other thing too is you need a quick relief medication for all your patients, which is again what? SABA PRN. So usually albuterol PRN. So make sure you read all the fine print there and look at that. It's also, the SABAs are also good to kind of monitor your patients and see how they're doing, because it can be an indication that they maybe need to be stepped up and then they may not have intermittent asthma. And like I said, I mean, go to wherever you want to go to refer to things. I like on this quick reference, it does have the diagnostic and it does show, excuse me, initial visit, classifying the asthma severity. So this is where we're getting intermittent versus persistent. And then under persistent, we have mild, moderate, and severe, right? So again, I like this table. It would help me maybe learn this, but if someone is diagnosed as having intermittent and they're using their SABA, they're using their albuterol like crazy, then they may need to be stepped up and they may actually have persistent asthma. Also to note, just as kind of a global thing here, that a specialist should be consulted if a patient does need to be at step 4 or higher. So that is, I mean, depending on where you guys work, if you're with a specialist, then you'll probably only be seeing step 4, 5, 6. But if you're in general practice or depending on, where you end up practicing, just note that, it is something for a specialist to do if it is above step 4. And then always another kind of global recommendation is step down when possible. So look at that. It's stepping up and it's also stepping down. That's it's something to look at. The other note too is that this is just a guide. This is not like the end all be all. I want you guys to look at it. And so some practitioners follow this, some don't. I think it's great for students, and when you're first out in practice and when you're on rotations, I think it's a great guide to go. But you'll notice here there's some fine print here too. Always look at the clinical picture and look at the individual patient needs, and don't just blanket it. For my testing purposes though, I will stick to this. I won't throw you guys curveballs. I won't, so for example, if I say the person has intermittent asthma, it's going to be the SABA PRN. I'm not going to be like, oh, but wait, they're allergic to albuterol or whatever. I won't throw any kind of, I want you guys to get this as kind of a good foundation and hopefully have a good foundation, then build on it once you have more clinical experience, once you're have more clinical expertise, then you get into nuances and stuff. You don't have to stick to it as closely. But I think for students, and then also for your boards, it'll help too, because they ask about this stepwise approach, etc. It is something to refer to. So let's go back here to the PowerPoint presentation. So I have listed the for the adults, and then 5 to 11, and then 0 to 4. So definitely look at all three of those. And the thing is, students have been overwhelmed in the past when I say look at all the different age groups and everything, because it seems like a lot of stuff. But if you'll notice too, I'm jumping back over here to the asthma quick reference. I like this one because if you go down here to the stepwise approach, it's really easy to find the similarities and things. So you'll notice step 1, SABA PRN, SABA PRN, SABA PRN. So I'm asking you guys to look at all the different ages, but it's not really a ton of different information. Does that make sense? So step 2, low dose ICS, inhaled corticosteroid, low dose ICS, low dose ICS, right? So it maybe seems a little more overwhelming at first than it really is, but I think once you spend some time with this, and this is part of these I'm doing at the very beginning of the module, the day 1, first day out of the gates, you guys can start looking to spend some time with these medications and hopefully get this system down, or at least get a good foundation down. So that's a lot of stuff. I know I didn't spend too much time on it, but it's because it's all on here, and I didn't want to read too much to you guys. Severe asthma exacerbations in adults. This rapid overview. Definitely put a star by this. I want you to know this. A guaranteed test question. So giving you guys a hint here, standard treatments. Put a big star by this section here. Want you guys to know that for my test, I guarantee there's going to be a test question that's going to come from there. So I've said that already twice. So hopefully there's at least 2 stars there. No, but look at that. And then also star here with additional treatments. So standard treatments, additional treatments, guaranteed that there's going to be an exam question, right? So mark my words or whatever. And if there's not, I don't know. There's going to be one. Okay, I'm going to write the exam. So there's going to, guaranteed. I want you guys to look at those. So standard treatments, additional treatments, read through those. I'm not going to read through you right now. We've already talked about these drugs before, but I definitely want you guys to look at them and make sure you know which medications are standard treatments for severe asthma exacerbations, and then which ones are additional treatments. And I encourage you guys to read through those. The rest of the stuff on this table, it's probably would be beneficial for ICM or maybe pathophysiology, I'm not sure. But for my testing purposes, it's just these 2 boxes here. I want you guys to know what's given, what's prescribed, what medications are given for severe asthma exacerbation. So that's the point of that. But the stuff about ventilation, intubation, it's good stuff. I mean, it's from Up to Date, right? It's good information. Maybe it'll help you with ICM. Next, we have the management of COPD, and this is by the gold category. So this is guidelines again. Want you guys to look at here. You notice it's categorized here: A, B, C, and D, symptoms, risk, and then the suggested treatment. So this is the one that I want you guys to star and look at, the suggested treatment. I want you guys to know first, second line, and alternatives. And again, you'll notice there is a pattern here. There is a theme. It seems like a lot of information, but I want you guys to please pay attention and look at that. And I believe it'll also help you with ICM. So go ahead and highlight this here and know first, second line alternatives. And then we also have the emergency management of severe COPD exacerbation. So again, guaranteed test question. Go ahead and put a star here by Pharmacotherapy. I want to make sure you guys know and be able to recall those medications that are used for the emergency management of COPD. So emergency management of asthma, emergency management of COPD, please, please, please know the drugs and be able to recall those, memorize those, etc. Same thing with the other chart. This is a good chart. I like it, and it's good. It has a lot of good stuff. It talks about management, talks about clinical features. So for my course, my test, I'm not going to be testing you on the management, but ICM may be. So this may help with management questions, diagnostic testings, etc. But for my test, please put a star there for pharmacotherapy. So that's the last slide I have for this. Is again, it's a really quick, it's a tiny presentation, but I want to re-emphasize the importance of it. There's a lot of good stuff here, so please spend some time with it, looking at these, and then specifically the parts I told you to kind of star and highlight. So this is a supplement to the previous lecture I gave with asthma COPD, but I think it's going to be beneficial and help you guys. And this does have test questions, so it is important to still study. So as always, feel free to email me, and if you have any questions or whatever. And other than that, thank you guys for your time and attention, and I'll talk to you later. Bye. Have a good one.